Right now, Gene Ross, with the co-president of National Nurses United, is with us. And on the ground with a med tent at the Occupy Wall Street. This is in New York. NationalNursesUnited.org, by the way, Gene?
Yes, nice to be here.
Thank you for joining us. And great to have you back with us. So tell us what's going on there. What are the National Nurses United up to with Occupy Wall Street?
Well, we, of course, are in solid support of the group out there. We had started with our own protest at the end of June and hooked up with some of the people who eventually started Occupy Wall Street, and we've been supporting them since. We set up a tent last week and made that our first 8 tent, and we have been staffing it with our nurses from across the country, and we've been busy attending to people that are ill, some of it from sleeping, out in the elements. Mm-hmm. We've been very busy there. Now, Monday, they tried to take our tent down, New York City officials. And Jesse Jackson came down and with others linked arms with us, and we barred them from tearing the tent down.
Wow. And this is when Mayor Bloomberg backed down.
Yes, that's part. And then Jesse Jackson returned the next day, and then he walked and made rounds with us, so to speak, all the places there, and the nurses were able to restock and get supplies in order.
That's remarkable. So the Occupy Wall Street movement in Manhattan is moving along just fine. The mayor's girlfriend, who's on the board of the company, this giant multi-billion, whatever it is, dollar company that owns the park, has not had their way, apparently. Do I have that right?
So far.
That's
right. That's correct.
So the top 1% billionaire mayor and his girlfriend, who's on the board of the company that owns the park, so far you all have backed them down, and National Nurses United is providing medical services to people at Occupy Wall Street in New York City. Are you doing it in any other cities?
Yes, we are in several of them, and I don't have all the cities for you right now. In some of the cities, like where I live in Minneapolis, there is the Occupy Minnesota group has already set up their own first aid tents, and we are just helping them. It isn't necessarily one that we set up. But that's one of the things we're doing. Some of them are we're just delivering supplies and serving food any way in which we can be of service, because we're all in it together.
Yeah.
We're working really hard in preparation for our action in Washington, D.C., November 3rd, because that's meant to coincide with the G20 meeting in France on the same day. And we're pushing for our financial transaction tax, which is so necessary and for which we have such global support right now.
Wow. National health care for Occupy Wall Street. That's or universal health care, free universal health care for the Occupy Wall Street folks. Keep it up. That's absolutely great. And of course, National Nurses United has also been working for, you have actually a special connection to Wall Street, shall we say. That's probably not quite the right word, but tell us about the campaign that National Nurses United has been waging for quite some time. I mean, you've been on this program, you've been on our TV program, not you specifically, but, I think you have before as well, but others also about this. Tell us about this.
Well, we have what we call our Main Street Contract Campaign for America. We found so many of our friends, family, and their patients all talking about all the things we know are going on now, the foreclosures, not being able to stay well, not being able to, getting sick because there's no home to go to. People can't afford their medications. We have always been in support of a single-payer health care system. We know that it's the only one that will ever work. And if people are so focused on the money, it's the only one that will save us money.
Right.
So we looked at the kinds of things that we know all people in this country should have, including everyone that would be a patient at some point in their lives, right, including ourselves. We all deserve health care. We all deserve a quality public education. We need a secure retirement, free from stress of worrying about where our next meal would come from. We deserve a roof over our head. We deserve jobs. The dignity of work. Yeah,
you're talking about Franklin Roosevelt's second Bill of Rights. But in the 30 seconds we have left, how is National Nurses United suggesting we implement this?
Well, the first thing we're going to start with, since everyone says we're broke, we have no money, is this financial transaction tax, the 0.5% on the riskiest of the speculation that the Wall Street traders do. We can start with that.
Right, a speculation tax.
To the other things.
Yeah, and extract some of that money back out of Wall Street that is being basically recycled for the benefit of billionaires and high-frequency traders and nobody else.
Right. We need it for our populace. It's as simple as that. The money is there. It's in the hands of fewer and fewer people, and the American people need it.
Yep. Amen. Well said. Jean Ross, registered nurse with National Nurses United. She is the co-president of National Nurses United. The website, nationalnursesunited.org. Get over there, check it out. And Jean, kudos to you for the great work you're doing with Occupy Wall Street.
Thank you.